Okay, so just a quick kind of overview. I'll do some brief introductions and then give Barbara a few minutes to just give a short description of the film in case you weren't able to view the documentary before tonight's discussion. Q&A first with some pre-scripted questions, and then we'll take questions that the audience members submit in real time. So feel free to do that like whenever throughout the Q&A event. And then ending with some calls to action. Okay, so intros. I'm just going to be pretty succinct here, and we will share this slide deck as well in the follow-up email. And I'm sure y'all can read a lot faster than I can speak this. But first is Dr. MaryLouise Patterson, currently a semi-retired pediatrician on staff at Weill Cornell Medical College in New York City. Born in Chicago to Black radical activists Louise and William Patterson, she earned her medical degree at Patrice Lumumba Friendship University in Moscow and a master's in public health at the University of California, Berkeley. Next is Barbara Berney. So Dr. Barbara Berney is a distinguished scholar in public health, environmental justice, and the U.S. healthcare system. Dr. Berney is an emeritus associate professor at the City University of New York School of Public Health and was inspired to produce this film by hearing eyewitness accounts from physicians, nurses, and government staffers involved in the integration effort and those who struggle to provide health services in rural areas lacking the most basic medical care. Eloho Akpovi. Eloho Akpovi was born in Nigeria and raised in Boston. After graduating from MIT in 2014 with a BS in Brain and Cognitive Sciences, Eloho served as a community health corps member at the Southern Jamaica Plain Health Center in Boston. She then went on to pursue her MS in Medical Sciences at Boston University School of Medicine prior to entering medical school. Through various OB-GYN research projects at Boston Medical Center, she researched anal cancer prevention in the HIV-positive population and examined the use of participatory action research to improve prenatal care delivery with both low socioeconomic status pregnant women and pregnant women with substance use disorder. Eloho is currently a fourth-year medical student at the Warren Alpert Medical School of Brown University in the dual MD-SEM degree primary care population medicine program. Rex Tai is a fourth-year medical student at the University of Illinois at Chicago College of Medicine, who currently serves on the executive board of Students for a National Health Program, SNaHP. His healthcare activism was spurred on by his experiences prior to medical school, organizing in drug policy, especially with regards to implementing harm reduction practices like syringe exchange and naloxone distribution for injection drug users on Chicago's West Side, many of whom have suffered from both inconsistent access to medical care and from high rates of stigma and suspicion when forced to interact with the health system, as well as from his time advocating for the elimination of cash bail and seeing the financial and health effects that pretrial detention has had on poor defendants of color. Okay, and now I'm going to stop the screen share so we can see as many faces as possible for the Q&A part. And I'm going to pass it off to Barbara, actually really quick, for a short description of the film, and then Sam to start the Q&A.
Hi, so I'm really glad that I'm here and that you're here. And I hope that those of you who got a chance to see it enjoyed the film. It presents, as those of you know, a poignant chapter in the historic struggle to secure equal and adequate access to health care, specifically through desegregating hospitals and using Medicare to do that. Now, before Medicare, things were really, really bad in the United States. In the South especially, but in the North as well, because hospitals were segregated and they actually, especially in the South, they turned away people of color for being people of color. And less than half of the hospitals actually served blacks and whites equally. And a third of the Southern hospitals wouldn't serve blacks at all, even in life-threatening emergencies. So the important thing that Power to Heal shows is that the civil rights movement and the government came together to use Medicare to desegregate the hospitals. And with that, I think we should start the Q&A.
Awesome. Thank you so much, everyone, for coming out, and all the panelists for agreeing to do this discussion. And yeah, if anyone has any sorts of questions that pop up, feel free to put them in the chat, or have any kind of points or discussion that you'd like to have, feel free to use the chat function. So the first question that we've prepared for the panel is, as many of us know, segregation still exists within the healthcare system, especially under the guise of insurance status and ability to pay. So what lessons from the civil rights revolution and the passage of Medicare can we utilize in fighting segregation in our current healthcare system?
Well, I can start. I think, first of all, that it's really important to remember that we're not only fighting for healthcare, that we're fighting for social justice. And there are a lot of pieces to this struggle, and that we have to form coalitions. Another lesson I think that we need to learn from the previous struggles is that you have to keep fighting no matter what. Even if you're losing, you have to keep fighting. It's really, really important. And you have to always be looking for the next opportunity, which I think now is the perfect example of that, because we have the Black Lives Matter movement, and we have COVID, both of which are bringing inequities to the fore and making them absolutely undeniable. You can't not notice. And I think that those are our current opportunities, just as Medicare was an opportunity to move the equity issue forward. And I think, and the other thing that I think that's really important is that government has a really important role to play, and we have to make sure that they play it. And that also is really clear these days. And the struggle to make sure that the government, both the state government, New York has a state health bill, I think, for single payer, and also that the federal government move this issue forward.
Thank you. Yeah. Does anyone else have anything to add to that?
I think what Barbara said is excellent. I agree with all of her points. I would add that one of the lessons from the civil rights movement is, for me anyway, is not only the unity that's required, that Barbara talked about, uniting various and sundry communities who have common interests, whether they recognize those common interests or not. But the power of the people, and I know that's it's a slogan we've heard a lot in the past, especially, but the power of the people once united to actually force change, force progressive change. And we should not lose sight of that. And to just pick up on a point that Barbara made, yes, there is a bill in the New York State, excuse me, the New York State legislature. It is for universal health care for the state of New York. It's an all comprehensive health care bill, which would include dentistry and psychiatric care, and actually even long-term care. It's a bill that we're trying to get out of committee and onto the floor for discussion. So there is that as well. The last point that I'd like to add to what Barbara said is that not only does the government have a role to play, I think that private industry has no role to play in the delivery of health care to the people of this country.
Yeah, I'd like to add on to what we've been saying about the role of government. I think that this period of the 1960s, as the film really illustrates, I mean, in the context of the Great Society and the civil rights movement, showed one of the most expansive periods of kind of the power of the federal government through the power of the purse in enforcing Medicare or enforcing desegregation through Medicare funds, as well as well, desegregation and also the bully pulpit that President Johnson used to really compel the AMA to follow suit with his Medicare program. As we know, the AMA was very against any real sort of changes to the healthcare system that would hurt their bottom line. But President Johnson used his position to kind of strong arm them into doing a program that helps the people. I think this is a pretty clear contrast between some of the messaging of the current administration that nothing will fundamentally change, or that he lets a lot of these private insurers and their lobbyists dictate what his policy should be. But that aside, I think that this showed the role that government can play in setting up systems of social support, but not only just the government doing actions from the top down, but because they're compelled by these grassroots movements, knocking on their doors, like making phone calls. We saw the incredible extent of grassroots power that made Medicare possible. I think this was really clear through the extraordinary electoral wins that were achieved in 1964, where LBJ or where Medicare was up in the election. There were pro-Medicare electoral candidates. All of them won their races, and this was very much achieved through a very strong mobilized base of grassroots activists, organizers, voter registrants. And I think that when the government can set a vision of very comprehensive policy, it really resonates with the people, and they really stepped up to make this happen. That's not to say Medicare is perfect by any means. There's a lot to that we still have to demand from our healthcare system, but it is probably the most significant transformation to the US healthcare system in US history. And I think that the political dynamics around it are very instructive to how we should think about our future fights for healthcare justice.
Yeah, and I would just quickly add that, just touching upon what Rex just described, like the importance of grassroots movements and how, regardless of whatever policies, laws are in place, it really does take grassroots organizing to hold institutions accountable, which we saw with Medicare and is what we're still seeing today, but what is really what will at the end of the day drive forward change within our healthcare system.
Awesome. Yeah, thank you everyone for all your great thoughts on that. And Rex, you mentioned this a little bit, and something that I personally have been thinking about as well is about AMA's legacy in terms of supporting different health policies. So, I mean, throughout the film, we saw AMA advocating against expanded coverage, while the NMA supported a national healthcare system. But interestingly, more recently, we've seen the AMA backing out of the Partnership for America's Healthcare Future, which is a dark money group that fights against expanded coverage. So that seems to be, a great win for us. But wanted to hear and listen to everyone's thoughts on and opinions on the AMA as a potential ally or foe, or a party that we need to stay wary of in our fight for expanded coverage.
Yeah, I'll take that issue first, just because I was one of the Chicago students that worked with this large Medicare for All coalition to stage a 1,100 person strong action and die-in on the floor of the AMA House of Delegates that I think we can directly attribute to the AMA eventually backing out of the Partnership for America's Healthcare Future. And I mean, that's not to say that there can't be important work done in the AMA. I think through relatively more incremental progress. But we're talking about very wholesale, like systemic change to not only the way healthcare is financed, but the kind of the relationship that we all have to health in this country. And I think the AMA represents a system that is very much baked around the system of healthcare as a commodity, as a system to make profit. And I think that's something that we're really trying to move away from, because I think that making profit in healthcare is a direct contradiction to ensuring the health of the public. And I mean, I don't think that there's a lot that is very, that there's a lot that we can celebrate the AMA's about the AMA's history in the context of all its exclusionary principles, them having this history of being against expanding coverage for our patients, against Black physicians joining the AMA. So I think that it is pretty important for us to call out what that exact positionality is, and look to the example of doctors like Montague Cobb, who was the president of the NMA and took a much more oppositional stance to them, or doctors Bob Smith and Dr. Walter Lear of the Medical Committee for Human Rights that picketed the AMA in Atlantic City. I think that SNaHP and PNHP are in very good company in light of our key role organizing the AMA protest in Diane. So, I mean, that's all to say. I think that the AMA represents a very entrenched way of practicing medicine under the current framework. But I think we're moving to something much more expansive and visionary. And I'm not really waiting for them to see it the way that we do. That's my view.
Well, I think that we certainly, we can't expect the AMA to lead this struggle. I think that their position has drastically changed in the last, whatever, 60 years. They've hired somebody really excellent, Aletha Maybank, to run their program on equity. And I think that tells us something. I'm not sure exactly what. And I think that you're absolutely right that, it was the students and the die-in that made the AMA withdraw from the Partnership for America's Healthcare. And I think that we can celebrate that they're not where they were, and we can't rely on them.
Awesome. Thank you so much. So this next question that we've prepared, and Eloho, you kind of talked a little bit about this in terms of holding institutions accountable via grassroots movements. And so through the film, even after Medicare was passed, it took time for hospitals to be compliant under Title VI of the Civil Rights Act. And so there were many hospitals that would try to hide their segregatory practices. And so how do we hold our institutions, whether they be hospitals, the federal government itself, payers, and others accountable to deliver equitable healthcare to the people?
Yeah, I guess I can chime in a little bit. It's really interesting. I think like in 2021, we have a lot more tools at our disposal to be able to do things like this. And I'm personally of the opinion that shaming them is one really easy way to sort of get them into action. And I think this is sort of where organizing amongst particularly, I think, medical students and residents are doing that, particularly thinking about White Coats for Black Lives and the racial justice report card that they do, can sort of, publicly show the policies and practices that are leading to inequitable delivery of care within hospitals, specifically academic hospitals. And that is a surefire way to publicly demonstrate that hospitals aren't doing the jobs that they're supposed to be doing in providing care, adequate care for their patients. And so I think it's, it's something that we have at our disposal that wasn't particularly available when the fight for Medicaid was happening in the 60s. And I think that it's something that we should certainly utilize. It's and actually sort of relating back to the whole conversation about the AMA, a lot of like Rex described, a lot of the advocacy work is being done by medical students and residents, the younger generation. So what in maybe 20, 30 years is the AMA going to look like, or hospital administration going to look like when the folks who are currently medical students and residents are in those leadership positions. Is it sadly going to mean that we're going to have to wait a few decades in order to get there? I hope not, but it's just something to sort of think about.
I think it's worth remembering that hospitals still have to be certified under Medicare. They have to certify that they're in compliance with Title VI and that they don't discriminate. And so in those cases where we think that's not true, if you work in a hospital or you work in another healthcare setting and that they're discriminating, I think, as you say, it's really worth it to point that out, to shame them, and to keep raising these issues. We really have to raise these issues, and we have to raise them in every possible setting and on every possible occasion that we can. And I think that this is a really difficult question. That it's clearly much easier for hospitals or any other healthcare setting to keep doing things exactly the way they've always done them. And so we have to be very inventive and hardworking and smart about how we hold them accountable.
And I would add that those of us that are in progressive healthcare organizations and movements, to pick up on what both of the previous speakers just mentioned, accountability, holding these institutions accountable, is that the Joint Commission on Hospital Accreditation is a body that exists, and they actually have a tremendous amount of power. They are the regulatory body that can determine whether a hospital can stay open and deliver care or not. They also have the ability to levy fines on hospitals for being non-compliant. So I think that there, that's one instrument that can be used, and organizations like PNHP and others can push to the federal government. And we now allegedly have an administration that is looking more kindly upon the populace than the previous administration, to push them to use these regulatory bodies that currently exist to hold institutions accountable, medical institutions accountable. I also think we need to begin to think about, how do we really begin to struggle against entrenched, systematized, institutionalized racism within medicine? How do we substantively begin to address that? How do we begin to push policies on an institutional level that begin to deal with institutionalized systemic racism within those institutions? How do we do it in medical schools? How are we teaching medical students? Do we have a history, for instance, of racism in healthcare, that a course in racism that's mandatory, that everyone who's going into healthcare, whether they're dentists, whether they're nurses, whether they're social workers, that have to take this kind of course, et cetera. So I think we need to begin to think about how we deal with institutionalized racism in medicine in ways that we can, and in ways that we can actually push for change. The AMA, the changes that we've seen are the result of pushing from below, from mass movement pressure. So we have that within our capacity, and we need to begin to think about those kinds of ways as well. And using what we've got, the powers, the leverage that we have now.
Yeah, I think this has been some really wonderful discussion about the scope of what we can do as physicians kind of in our own communities. But I still want to touch a little bit more on, I think, the broader grassroots struggle. And this is a really nice, like, kind of full circle conversation for me, because in Illinois, we actually are celebrating a huge legislative victory today. The Pretrial Fairness Act was signed by our governor, which ends the practice of cash bail. So now people who can't afford their bail won't be incarcerated before they've even been convicted of a crime. This is something that I kind of cut my chops in as an organizer before medical school. But you can see it took almost 5 years for us to make it happen. And I mean, unfortunately, I haven't been able to be super involved as a medical student, but I've been following the campaign very closely. I know that it took thousands of phone calls, thousands of legislative visits, all sorts of pressure continuously for this to happen. And I think that when I watched the film, this is even more evident to me. I think that the success of Medicare's passage reflected a level of grassroots mobilization that I don't think we've seen in quite a while. I read Dr. David Barton Smith's book that this film is based on, and he talks about how there's just so much movement organizing that went around this. There were 14,000 senior citizens who marched to the 1964 DNC convention. They flooded hours-long Senate subcommittee hearings around the country on Medicare. They did nonstop phone banking drives that made the victories of all these pro-Medicare candidates possible, and led to their electoral victories. And then with the actual implementation of desegregation, I think the best part of the film for me was kind of near the back half of it, when it was describing the 2-month deadline that the HEW office had to meet to ensure that hospitals, nearly 2,000 hospitals around the country, were actually desegregated in fact, and not just in name. And 2 months to visit hospitals across the country is a monumental task to me. And it was really this like large volunteer army that trained and recruited themselves under threat of KKK and police violence to go to these hospitals and actually observe for themselves, report back to HEW, and like do the actual dangerous groundwork of making this possible in their field teams. So like that is a really like inspiring piece of grassroots coalition work, activism that really speaks to me. And that's something that I really hope that we can channel for the future. And it's going to take much more than just us as physicians. It'll, if we ever get to Medicare for all, it'll be a reflection of that level of like mobilization across all these different community orgs, coalitions, that I think we need to really think about how we build that sort of collaborativeness. So we have some work to do.
Yes, indeed.
Yep, definitely agree with that. And so we're going to start going to questions from the audience. And so people from the audience, feel free to put it in the chat or DM Jess or I in the chat. So the first question is about how would you suggest organizing during the pandemic? And I know this is certainly something I've thought about too, and how difficult it can be when, for instance, Jess and I work together on multiple different events for the New York chapter for SNaHP, but we've never actually met each other in person, which is, I think, kind of funny in some senses. But yeah, it's definitely a struggle and adjustment. Wondering, what are everyone's thoughts on that?
Well, I think that this is a really hard time to organize. I mean, it's very, what can you say? I mean, it's very hard to organize when you can't get together. But on the other hand, I think it's a really exciting time to organize because there are lots of organizations out there, and it's not like you have to start from ground zero. Even in New York, there's New York Metro Healthcare for All. There's Physicians for National Health Program in New York. There's, you have this state legislation, and you have a really good chair of the Assembly Health Committee, Richard Gottfried, and you have in the New York Coalition to Dismantle Racism in the Health System, which is mostly, I think, focused on what goes on in medical schools and to a certain extent in hospitals. I know that the New York State Nurses Association is very involved in moving forward both more access and a more equitable health care system. So I think that the fact that there are organizations out there that are already working on this issue really makes it much easier than if you had to go create an organization in order to be able to do something. And students for National Medical Association and the student chapter of the AMA.
I will also add that, good old fashioned word of mouth is also very helpful. A lot of the organizing efforts that I've gotten involved in have just been because someone who's a mutual friend sends me a text and say, hey, I know you've done this work in the past. Would you be interested? Or would you have capacity? So I would say don't count those out. Reach out to your networks and utilize those connections and use word of mouth. If you want to get something started, reach out to someone who you know has a similar interest, and they might know other people who might also be doing work that you could collaborate on and don't have from scratch.
And
and then you could,
go ahead.
And then the use of this technology, which we're doing tonight, to educate ourselves, to come together, even though we haven't met, but we will one day, hopefully sooner rather than later. But the use of this technology to educate, to bring more people in, while we can't get together, we can certainly talk and share knowledge and share experiences, and try to enlarge in the circles. And bring more people in. So I think that this technology in this period is making it possible to continue to organize on that level, in that way. To urge people to send in postcards, as Rex was saying, phone banking, postcard mailing, etc. Calling your congressperson, your congressional representative, whether it's your state representative and your federal representative on the issues. All of that can be organized using this technology. So I think we need to use what we have at the moment.
Yeah, I agree with all of the above. It's definitely been difficult to do the kind of organizing that we used to do. But I think this period has been very instructive. We've become a lot more comfortable with using these different technologies. It's doing things virtually has been much more normalized, which I think has facilitated a greater level of collaboration, at least for SNaHP, than in the past. Like we've had opportunities to work with SNMA and some other organizations, and I think that this period of time is just allowing us to do a lot of education amongst each other, kind of build each other up, because we're gonna really get to it once we can get back to the streets and in person for all the stuff that we need to do.
Awesome. And Barbara, did you want to say something?
No, I think that you
Okay.
said everything that I was going to say.
Okay, great. So next question we have from the audience is, I know this past year and recently there's been interest with anti-racism in medicine. I was wondering if the panelists can comment on how anti-racism in medicine and the pursuit for single payer can complement each other.
Well, I think that members of the audience should feel free to comment on this as well. But I think that it's really important to remember that if we only have one payer and they're paying the same thing for everybody, then there's a lot less reason to discriminate and decide you're going to see, white people instead of people of color, or you're going to see rich people instead of poor people because you're going to get paid the same thing no matter what. I mean, that's kind of what single payer means. And I think that that's a really important thing to think about, that as long as we have different payers paying the same people different amounts to do the same thing, then we're going to have discrimination. And it's hard to imagine that we're going to have a system like that, where there's different kinds of health insurance and some people get one and some people get another, that where those distinctions are not going to, even if they're based on income, which they probably will be, that there's certainly going to be a huge overlap between that and race. And even where there isn't an overlap, people are going to get discriminated against because of their race and other things, and their immigration status and all of those things.
I think as long as there is profit in providing health care, everyone's health care then is questionable. And then the health care of people who have historically been maximally oppressed is obviously going to be worse, or the worst. But it doesn't mean that those people who don't consider themselves oppressed or don't know that they're oppressed are getting really great health care. They're not. And so the fight against racism in healthcare is really the fight for the quality of healthcare for everyone in this country. It's not just for the quality of healthcare for Black people, Indigenous people, and Latinx people and other people of color. Not at all. And that's the message that I think that we have to get across to the general white population, that we're not taking anything away from them. They're not losing when we're providing quality health care to people who've been denied quality health care for everyone, forever. That in providing quality health care to people who've been historically denied, it will actually improve the health care of everyone. And it's a hard message. It's a hard message to get across.
I think it's very hard because, we're taught that you get what you pay for. And it's a really bad message for healthcare, right? Because for one thing, you don't have any idea what you're, by and large, you don't know what you're getting, right? Like patients are not very good at determining quality. You know, we can tell if a doctor or a nurse or whatever is being nice to us, but if they're making the right medical decisions, that's much harder. Might be impossible. And also, of course, many of those decisions are not decisions that you get to go home and think about and call up whoever and, you know, get a second opinion and blah, blah, blah. A lot of those decisions, a lot of the expensive decisions are decisions that get made right this minute and get carried out right this minute. And, you know, are you going to question like what hospital your doctor is going to send you to, or what procedure she's going to do, or, you know, I'm pretty sophisticated. I'm not in a position to do that.
I think these discussions about anti-racism that are really popping up in medicine have to be very mutually reinforcing with the discussions about how we pay for healthcare in this country, like how this system is structured. Because I mean, I can't see this under any other sort of political diagnosis other than the system of racial capitalism that the privatized corporate health system props up. I mean, I think that hierarchy is baked into the way that healthcare is practiced, and racism is about hierarchy, like class inequality is about hierarchy, and the system that we have makes it so, like, if you're poor, then it makes you sicker. If you're sick, then you are also poor. And like, in the sense that we have created classes in this country that are also racialized, like, we can't really move away from that if we're not thinking very, very closely about the ways that racial and economic justice are intertwined.
Yeah, those are all really great thoughts. Thank you, everyone. So our next question from the audience is, I'll just read out loud. Hi, thank you so much for speaking. Can you speak to how you think the messaging around Medicare for All could change to better center racial justice? How/do you think the movement has suffered from a single issue approach?
That's the talk of our times, isn't it? Like, this is a conversation that comes up all often as we think about the past year and kind of everything that's been going on with the pandemic. I mean, like, we've said this multiple times, it still bears repeating, like, getting to Medicare for All doesn't end racism, but I don't see how we can end racism without the decommodification of healthcare. And I mean, the fact that health is so personal, so fundamental, I think that it's very difficult to move to these larger understandings and visions of how we help each other as humanity, if we are still stuck in this mindset of keeping healthcare like commodified. Again, I think that it's very much about highlighting those connections between this system of capitalism and racism, that and the ways that we need to mobilize around these connected issues that we move forward. Yeah.
I think that there's no question but that the issue of universal health care and healthcare for all very, very much suffers when it's not tied to a social justice movement, which fights for social justice in all areas. I think that, you know, one of the things that the civil rights movement teaches us is that, you know, this was a brief moment in American history when the majority of the people were willing to say, we're all in this together. And that's how we got help. And that's how we got Medicare. That's how we got Medicaid. In fact, David Barton Smith says quite explicitly that Medicare was a gift to the United States of the civil rights movement. And I think that it's really important. You know, we talk about in healthcare, we talk about the social determinants of health. And at a meeting that I was at, somebody said, well, we should really be calling them the political determinants of health. And I thought that was really useful because political determinants of health, obviously we could change. Whereas somehow, if we call them social determinants, they don't seem as changeable. And, you know, I think that this is one of the things that COVID has taught us is that the things that underlie health are the things that determine whether or not people get sick. You know, they may or they may not get decent health care after they get sick, but whether they get sick or not has to do with what kind of job they have, which has to do with what kind of education they have, which and definitely has to do with what their living situation is like, what their housing situation is like, what kind of neighborhood they live in, all of these things. And I think that to try and talk about healthcare as if somehow it was divorced from these other issues is really, it's very difficult and it's a huge mistake.
Awesome. Thank you so much. Oh, sorry. Rex, did you unmute? Sorry.
Yeah, I mean, I was just going to very quickly reflect what Dr. Berney was saying about knowing our history and kind of understanding Medicare as the gift of the civil rights movement. They made, when the civil rights movement kind of expanded into the Poor People's Campaign, they took like an analysis of healthcare, and I think that carried on forward with the Black Panther Party and the health clinics that they set up, like really tying all of these issues and this political work together with health. I think that's very much I think that's a very important model of the past, and I think it should definitely inform how we understand all these issues for the future.
So another question we have from the audience is, there's a lot of propaganda around Medicare, such as labeling as socialism, and people not wanting to support it because of that label. So how do we use grassroots organizing to get around that propaganda and reach people who would support Medicare for all? I'm thinking along the lines of how Florida went for Trump, but voted for a $15 minimum wage.
You know, there's lots of popular support. Way more than the majority of population supports universal health care. Now, you know, there's this problem that the more detailed you get about what it's going to look like, the more support you lose. But I think that that's really important. And I think it's really important to remind people that we are the only industrialized country that does not have universal health care. The only one. We've been the only one for 50 years. I know this because that's why I went into healthcare, because I thought, well, you know, we don't have to see state power in order to get universal health care. And so I thought, Well, so surely if I went into healthcare that we'd have it by the time I retired, which turns out not to be the case, but nevertheless, I think that, this is a really important thing to remind people that, somehow all these other countries, Sweden and Denmark and France and England and Germany and all these other places have managed to have universal health care, and they're not socialist countries, not yet.
Well, yeah, I mean, these political labels, they're so loaded at this point that it definitely can just mislead and misinform. And I mean, I have my political diagnosis and all of these like academic terms for it, but when I actually like try to get into organizing conversations with people who like need healthcare, which is everyone in this country, I'm going to try to personalize it a lot more. So I try to ask them questions like, how would your life change if your healthcare was guaranteed? If you could see any doctor in the country that you want and you don't have this insurer that's telling you what your network is of coverage, you can just see anyone. If you change jobs, you can stay with the same doctor. If you are, you could tie it to so many issues. Like there are women who might have to stay in abusive relationships just because they're tied to their husband's employment. They would have more freedom to move away because their healthcare would be guaranteed. It would unlock American entrepreneurship if people don't have to take this massive gamble about not having insured healthcare for a period of time while they're building a company that could be guaranteed. You could feel a lot more free to start up your own business when you have this level of comfort that's guaranteed by this program. So I think once you get past the labels, like really bring it back to the person, kind of what is their relationship to the healthcare system, and ask these kinds of questions, I think that you will really start to tease out the incredible level of popular support for this program and the widespread level of frustration people have with the current system. I know it's there.
I agree. I also think that the term socialism is not as loaded as it used to be. And so I think, as Rex just was explaining, that we can, it's easier to get around that term now, and to get to talk to people, to explain to people how the government paying for healthcare instead of private insurers would guarantee not only health care, but could also begin to guarantee health in a way that has private industry can't do, won't do, doesn't want to do. And the other thing is that people, when you start telling people that their dental care will be taken care of, and their eye care will be taken care of, including their glasses, that any kind of psychiatric care that they need will also be provided, that long-term health care then will be provided for as well. That, then as Rex was saying, then you begin to win over a lot more people. And that's what we have to do. I mean, we have to explain what it is. And why is it that, for instance, President Truman, when he was the president, tried to get it passed? Roosevelt tried to get, universal health care passed. Neither one of those presidents were socialist, communist, pinkos, reds, or any of those crimson shades. So it's talking to people, it's reaching out to people, it's going into churches, it's going into union halls, it's going into daycare centers, it's going into places where people are congregated, where we can reach people. And then right now it's using forums like this to reach out and to explain what it is. And as Dr. Berney was saying, it has nothing to do with socialism really. And the majority of the countries in the world that have universal healthcare are not socialized, don't have socialized economies at all.
And I would also,
go ahead.
just quickly, I would just also add that another approach is also asking people what they would like to see changed about the healthcare system. And oftentimes those types of conversation would elicit a lot of what Rex and Dr. Patterson just described, which is essentially what we're trying to get at in terms of universal healthcare. But it's just that people aren't used to associating the needs that they have for their healthcare system to a single payer system, and being able to make that connection for them in conversation, or even just guiding them to making the connection for themselves can be a way to change their perspective.
And another thing that I think that this issue of private versus public brings up is, your insurance company can be totally arbitrary and capricious, and often is, and decide, this service isn't covered, or that provider isn't covered, or whatever. Whereas the government can't do that. The government is not allowed to be arbitrary and capricious. The government has to have a reason. They have to lay it out. They have to go through a procedure, blah, 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 all that stuff in order to be able to decide who's in it. Not presumably, if we had single payer, all the patients would be in, all of us would be in. But, if they're going to decide that some procedure is not in, or some doctor is not in, or some hospital is not in, whatever, they have to tell you why. And they can't do it between today and tomorrow, because they feel like it.
And we haven't even talked about the bureaucracy that private healthcare and healthcare and insurance industries impose on and really hamstrap healthcare providers. The amount of time that healthcare providers spend in filling out forms and that have to do with insurance and have to do with payment. And if you don't fill it out correctly, you don't get paid. It gets bounced back, and then you have to fill it out again, or you have to hire staff that does that. So they're not even providing care. All they're doing is billing. So the amount of money and time that is consumed in trying to even get reimbursed for the care that you do provide, or the care that your doctor is providing you, or your nurse, whoever it is, your dentist, is providing, is incredible. And so when you talk to providers who are now having to fill out endless forms and comply to endless algorithms, and if you don't fill it in the right way, then the institution that you work for maybe begins to punish you for not completing the form correctly, for not using the correct billing code, for not billing at a high enough level, or you billed too high, and the large billing departments that we have in hospitals probably rival the healthcare providers, number of healthcare providers. So it's such a waste. And so I think that's an argument again, especially with providers. And if you talk to providers, so many are unhappy with, that end of it, the billing end of it, the insurance companies you have to call to get okay to get the patient a CAT scan. You have, somebody who's not a doctor who's deciding whether your patient can get a scan or not, or can have this operation or not, or can have that, that device put in, or that particular medicine, especially if it's if it's an expensive one. So that's an argument I think that we can begin to use with providers, but can also show our patients. I mean, I've had patients, friends of mine who said, I went to the doctor, I waited an hour in the waiting room, and I saw the doctor for 5 minutes. And then the doctor spent 15, 20, 30 minutes filling out the chart. They'll tell you that the doctor never even turned around. Their face was in the computer the entire time. You know, so this is the kind of care that people are getting. And when you really begin to talk to people, as well as providers, we're all unhappy. And it doesn't have to be.
Yes, thank you so much. Just to be respectful for everyone's time, we're going to have to end the panel discussion there. Unfortunately, this has been such great conversation. Thank you everyone for sharing your thoughts. And before everyone goes, Jess and I would like to go through a couple events that we'd like to publicize and have a few call to actions.
Yeah,
Jess, do you want to?
Yeah, everyone can see my screen, but SUNY Upstate is hosting an event on Wednesday, the 24th at 6 p.m. Featuring Dr. Susan Rogers, who's the president of Physicians for a National Health Program, the national level, titled Why We Have Racial Health Inequities. And we will drop the links to RSVP for all of these in the chat, as well as follow up in the email. And then PNHP, the New York Metro chapter, their March forum will be about achieving healthcare for all, the New York Health Act for a just COVID recovery. And it'll be more of a hands-on workshop type forum. So March 9th, which is a Tuesday, 7 to 8:30 p.m., gearing up for our 2021 Lobby Day, which Sam will tell us more about.
So we're going to be planning a 2021 New York Health Act Lobby Day that will be completely virtual. And if you're interested, we'll be sending out the link for signing up for that. And we'll help you get trained in terms of how to lobby and get paired with other interested people to talk to actual legislators that are involved in the process. And then finally, we have a SNaHP summit that will be happening on April 23rd to 24th. It's going to be virtual as well and completely free of cost. And we're looking forward to having some great conversation there as well, especially around coalition building. So thank you all so much for coming. And we really appreciate everyone making the time to come, and especially all the panelists for volunteering their time to share all their thoughts.
Yeah, good night, y'all.